Hi, my name is Alicia Riley, and like most of you, I am recording this video project for Health Information Management 4520. Today I will be talking to you about paper health record filing systems. I am attaching a PowerPoint presentation in my Blackboard posting along with this video so that you can reflect back to it if I go too fast or if there's something you missed or didn't understand. With that, let's begin. I'd like to give you a little bit of history of paper filing systems, not so much medical record filing, but paper filing systems and how long they've been around. They have been around for a very long time. Over 5,000 years ago, the Sumerians used cuneiform to record such things as their crop yields, business transactions, what the weather was. And they printed, they kept track of their information on clay bricks. The clay bricks were then filed in a library for future use, and they actually wrote in cuneiform to record this. As far back as 2,300 years ago, the Greeks used pen and papyrus or parchment paper to write books, and then they filed them in their library in such libraries as the Library of Alexandria. So as you can see, filing systems have been around for a really, really long time. It is not just something that's used in medical records. Obviously, it's used in all types of industries. It could be an insurance company or an insurance agency. It could be regular general business filing, accounts payable or receivable receipts. It could be a legal office, a small veterinarian or a dental office, or a large hospital facility. I do have a PowerPoint presentation up, so if I continue to look off to the right, that's why I'm reading from my PowerPoint notes, so I apologize about that. And with that, let's start with medical record filing. In the medical field, as we all know, filing is one of the most essential processes when it comes to the management of information. If you do not file your records and keep them safe, retrieval of the information in the time of need is going to be greatly impaired. Different methods of arranging medical records will impact the maintenance of records and retrieval of information. The record identification and filing systems form the first step in a series of procedures in the management of healthcare services. A medical record has no value if it cannot be found once it is stored somewhere in the file area. Careful planning of the record identification and filing systems to be used is of great importance. The choice of the system, however, also depends on the specific type and circumstances of the healthcare facility for which it is selected. With that, there are several different types of paper medical record filing systems I decided to go over. 4 in particular were the terminal digit filing system, which is known by the initials TDF, a straight alpha system, a straight numeric system, and then also a middle digit filing system. In terminal digit filing, there are some pros to this system. It's the most often used filing method in the medical industry. It's the only way to keep expanding at an even rate. It does not recreate the medical record number used by the facility. Color coding, if you so choose, is also easier with this type of filing. And what I mean by color coding is we've all been to the doctor's office. I'm sure that still has some paper charts, maybe your dentist's office or your veterinarian's office. Number 6 can be burgundy, number 5 can be blue, 3 can be yellow. The numbers are associated with different colors. Some more of the pros to terminal digit filing is it increases your file staff room productivity. Your workload assignments are easier. The filing system works in all offices of all sizes and specialties. Purging is easier. Locating the file is immediate, and it reduces transposed numbers. And for anybody that's taken an accounting course, you know the two most transposed numbers are divisible by 6. Usually 6 and 9s are usually the ones that are transposed the most. Some of the cons to the terminal digit filing number system is it is not the easiest to learn. Numbers are read from right to left, which is totally opposite of what we read now, which is left to right. You do need to have an increased amount of floor space. You need more equipment, such as the actual file folders, the types of forms, the stickers and numbers to put on the file folders, and also the large filing cabinets that store the folders. Your file room in the beginning must be very well organized to accommodate the need for more space. The user must understand the primary, secondary, and tertiary numbers used in the terminal digit filing. Now, on my PowerPoint presentation, I do have an example of the record. It's a 6-digit number for terminal digit. The example I'm using is 01-04-00, and I do have it written on this card here. So when you're looking for a foul, the first number you look for is 00. And then you look for the second set of numbers, which is 04, and then the third set is 01. So this is the primary, secondary, and tertiary numbers that you're looking for in that system. I will say that I used to work at a hospital that did use the terminal digit filing. It was a nice system. It was hard to understand and hard to catch on to the first time. But I will also tell you that since it was paper files, if you have a patient who comes into the hospital and has stayed for, let's say, 3 or 4 weeks, that they've got maybe say MRSA and diabetes, and maybe they're in the wound clinic. Wound clinic can have one chart. If the nursing unit can't find a chart, they start another chart for the patient. If that patient has to get on to X-ray or for some blood work, lab starts another chart. It can get very cumbersome. You can get so many charts out there. And once all those charts are collected and got back into the HIM department, we were constantly tearing charts down, putting them in order, because the nursing unit, let's face it, does not have time to file all of the paperwork that comes in on a paper chart in the order that the Health Information Management Department would like it to be filed. There's constantly reports coming up from the lab or X-ray or wound clinic. It was hard to find, especially if the patient had been discharged a little too early and would present back to the ER within 24 to 36 hours after discharge. You don't know where the record was. The only way we could track that record was we had a barcode on the file, and you would scan it. And when you scanned it, it would pop up, where is this record located? If it was going to the nursing floor, you'd say nursing. If it was going to ER, you'd tell it, you'd select ER. If it was going to the lab, you'd say lab. In the real world, that was supposed to work. In the book world, it was supposed to work. I apologize. In the real world, it never worked. We were constantly hunting down charts. It was not a fun thing. Computerized is much better, I will say that. The second type of paper filing system is alpha filing, and that's exactly what it is alphabetical: ABC, EFD, HIJ. That's how you file them. It is the easiest to learn, and it's the easiest to use. Records are filed by the patient's last name followed by the first name. It allows for fast record retrieval, and when you add records after purging, the records will still be randomly spread out over the 26 letters of the alphabet. Your master patient index number is not needed to cross-reference the patient name or record number for this. Now, some of the cons on this: there's more misfiles. You get someone who calls in from a unit, maybe it could be someone who speaks with an accent and you don't understand the name. You could be looking for Mr. Smythe when it's actually Mr. Smith. The common misfiles are McFarlane versus MacFarlane, which is MIC versus MAC. That's a common thing. So the users really have to be up on their etiquette as far as the rules of filing, whether MC goes before MAC, those kind of things. Some of the other cons to an alpha system is that if Mary Beth Jones gets married and she's now Mary Beth Smith, we don't know. We're still looking under Jones when someone could have named the chart, changed the name on the chart to Smith. Nowadays, we find that people are having gender changes. They change their first name, and they may keep their last name the same, but you have gender changes that also make it hard to find an alpha record as well. Lack of confidentiality. If someone gains access to the area that they're not supposed to be in and wants to look up their neighbor just to get something on their neighbor, they could walk right in and look up John Jones, and there it is. So that's not a good thing. We all know that's I'd like to say it can never happen, but I know that it does happen. Somebody could be walking along the hallway. In the cart, the Health Information Management cart could be there, and they're unloading all the charts, and they get busy. Something happens. Everybody runs, and someone walking down the hallway can pick up someone else's chart they may know, or just take it just to be weird. All of those kind of things can happen and make the alpha chart very unsecure and non-confidential. They're also inefficient and cumbersome in large practices because you get a lot of people with the same initials. You get junior, senior, you get the second, third, the fourth, all those kind of things. If someone's not giving you that information on registration, or someone doesn't write that down correctly, you could be filing the wrong paperwork in the wrong chart, or you could be pulling the wrong chart for the person's visit. Any of those combinations can happen. The third type of system is straight numeric. And now there are 3 different types of numeric filing. One is called unit numbering, one is serial unit numbering, and the other one is serial numbering. On these 3, the pros are that the user decides what number to base the filing system on. It could be an account number, social security number, it could be a medical record number, it could be the MPI number, anything they want, or it could be generated randomly, whoever wants to pull whatever. This system is easy to train employees on. The files are in chronological order, and the unit numbering system is good for larger facilities. Serial numbering is good for small facilities where there's little or no recurring visits. Now, the cons are on these. Under serial numbering, one of the cons is the patient receives a new number every time they receive a service at the healthcare facility. So that means if you have someone that's chronically ill that comes in for treatment and that presents to the ER 3 or 4 times in a month, they're going to get 3 or 4 new medical record numbers. Obviously, the first thing that should pop in your mind is, wow, what about continuity of care? How do you keep track of what's been done to them, what's not been done to them? That's why that's a con to this system. It would be very hard to track. More than one department may have the records on the same patient. If the patient presents to the ER and had just been into the lab or x-ray 3 days earlier, that records could still be sitting on someone's desk in the x-ray department waiting for the x-ray to be read. Excuse me. So it's not a real good system. I will tell you, at the hospital I worked in, it was a good thing we had terminal digit filing, because I'm not kidding you when I tell you we had a man who presented himself every day to the ER. He would come in by ambulance, sometimes he'd walk in. And if this, I swear to God, on my children's life, is the truth, he would come in just to see what we had for lunch. He had chronic obstructive pulmonary disease. He's long since gone. And he was a smoker. And if he didn't like what our hospital had, he'd call the other hospital and have the ambulance service transfer him from our hospital to the other hospital. It was a game. We're going back 20 years. So it does happen. I mean, he was a frequent visitor to the ER, and sometimes he did get inpatient stays. Sometimes he truly was sick. In serial unit numbering, excuse me, gaps are left in the area where the old records existed. It's time consuming to keep moving the records to reduce gaps on the filing shelves. It becomes very cumbersome when looking for multiple record numbers for the same patient. Back to that chronically ill patient who presents to the ER 4 or 5 times in the same month. How do you ever track what was done? Excuse me. In unit numbering, records can become large and require multiple folders. And by that I mean, if you have a patient that has stayed 30 days in the hospital, who's there maybe for wound care or MRSA and has a complication of diabetes, maybe has a heart attack while they're there, that folder can get very thick. At some point, you're going to have to break that folder down into 2, and now you have 2 paper records or 2 folders to be tracking. And there were patients that I know of that had 6 and 7 files that were 2 and 3 inches thick at least. So that becomes very hard to keep a track of those records, who has what. Like I said, we used the barcode system where you scanned it, but not all the departments used that. Estimating the space needed for the file room is difficult under the unit numbering. It's also time consuming to continually shift those records to accommodate that expanding record volume. And I want to tell you, sometimes we were doing that daily to move the files from one shelf down to another, and then would go through a purge and everything and get moved back up, and it could be kind of crazy. So another way a paper filing system is called the middle digit filing. It's very similar. The pros to this is it's very similar to the terminal digit filing, except the middle digits are used as the primary sort numbers. So on here, this is not the best example, but on here, if you can see this, this middle set of numbers is your primary numbers. Okay, that would be the ones that you're going to sort with, and then you're going to move over to the set of 3 digits. I'm sorry, it's 3 digits. And then you're going to move over to the 4-digit section. So that one's a little more different too. One of the other pros to this one is that every 100 record is on the same. Every 100 record is on the same shelf. It does not recreate medical numbers, so you're not just making 10 new numbers for the same patient every time that patient comes in. You have one number and it's uniform across the board. Color coding, like I said about the little colored numbers, where yellow could be number 3 and green could be 5. This is a good system to use the color coded numbers with. It does increase your file room floor productivity. Your workload assignments are easier. The filing system works in all offices and of all sizes and all specialties. And purging this type of a system is a lot easier. Now, the cons are, again, like terminal digit filing, it's not the easiest system to learn. You do have to have a lot of floor space for it, because you never know how big the files are going to get. And you also need more equipment. Again, the filing cabinets, the folders, the numbers, at some point probably more staff, those kind of things. In the beginning, again, your file room must be well organized to accommodate the need for more space, and it is hard for users to learn. But once you get onto it, I think it would be okay. I've never personally used this system, but I can honestly tell you I would probably just want to use the six-digit terminal digit filing over this one. This is 9 digits like your Social Security number. Excuse me, I'm going to take a drink. A tickle in my throat, I'm sorry. So that's the end of the 4 types of paper filing systems I did my research on. Now, some of the things, if you are one of the people that's on the committee, or you are the person helping make the decision, or the last stop on the train that has to make the decision, some of the things you want to consider when you're selecting a paper medical record filing method is look at the needs of your facility. Is it a large facility? Do you get repeat visits? Do you have a lot of, are you a cancer center where people are going to be in and out 6-7 times in a 2-week period? How often are those records going to be needed? Are you going to pull them daily, at once a month, once a year? Excuse me. Your space. How much space do you have? How much space do you want to allocate to this? A computer, you can store a lot of files in a short amount of space, whereas paper, how much do you really want to allocate? What are your resources for employees? How many employees do you want? Do you want to run on a lean staff, or do you want a staff that's overloaded and have file clerks just constantly doing redundant filing of paper and things like that? Really, or constantly searching for records. And how are you going to keep track of those records? That's the other thing too. Access to the system. Is your system going to be easily accessed by unauthorized person? There again, the person walking down the hall, and if their name is on there, you can say that no unauthorized person is going to get access, but there's no guarantees in life except for death and taxes. Confidentiality and the cost constraints. What's it going to cost? What's the initial cost? What's the ongoing cost? Is it still going to be feasible in 5 years? Looking down at down the road at a 5-year plan. If you still choose to go with a paper medical record filing system, some of the questions you want to ask yourself before implementing the system you choose is the system logical? Is it practical? Is it simple? Is it functional? Is it retention conscious? Because we all know those records have to be kept for a certain period of time. And if you have stacks and stacks and stacks and stacks of folders that are basically what we refer to as a dead folder, you can sure store them in the basement, but there again, you still have that space accommodation or space conflict there. Is the system flexible? Is it going to change to meet your needs 5 years down the road? And is it standardized? Will everyone else coming in be able to understand the system? So that's pretty much the end of my presentation. Thank you for taking the time to view my presentation. I want to wish everyone good luck. Finals are coming up in about 3.5 weeks here. And everybody have a good day. Thanks.